kama wale wa matatu wale wa envelope wale ukiitwa saa hii upewe envelope, bro, niambie tu kweli.
Hapana. Mwambie kujeni State House Mombasa tuongee.
I can even leave to my right hand.
Because not that is exactly what we do. Let's call a fact a fact, yes? And a speed a speed.
With the due respect na watu wake, wacha nikwambie. You know, we are part of the people who was also not, we were for heaven's sake to the honor vibaya. Because what we were actually pushing for was not agreed upon. Sasa wakaenda wakaitwa pale na mheshimiwa mtukufu rais, wakaelewana, and what they agreed. You know, maybe I don't talk about another sector, but in the health sector, I can bet with you, take this to the bank. As long as our UHC colleagues don't have PNP letters, and so long as we have not been, there's no centralized negotiation on RN CBS, we still go on strike. So long as they're not paying the service gratuity for UHC, we are going on strike. And so long as the government is not employing healthcare workers, and you know, we have been having teachers being employed close to 56,000. I keep saying this. The same speed the government uses to employ 56,000 teachers, we need to see it in the health sector. We have been seeing police officers being employed on an annual basis. Why are we not actually employing healthcare workers? And as a nation lives because of three things. One is education, security, and health. Because a sick child cannot learn. Yeah, that's for a fact. Because all these things intertwine. They interface. They work together. So we are saying, if the Council of Governors is unable to handle us or healthcare services in this country, for heaven's sake, let them release us to the national government. At least we are better off at the national government. We can be able to have a negotiation and sit down the way teachers are doing and the way police officers are doing, and actually have a discussion about this issue. I'm sure if this issue was about the national government, hatuko tumefika hapa na hii mgomo, tuko tumemaliza kitambo. So I wanted to dissuade the fact that tutaitwa bahasha pana. Sisi tutaitwa kwa meza to discuss issues and agree on the issues as outlined in our different strike notices, but not to sit down and say we want to watu wawili watatu wanapelekwa wapi. Hapana. We don't believe in that. We have a way of and you know, the general secretaries, you know, for a strike to be called, there's something called a National Executive Council.
Yes.
That actually tells the general secretary, like my position, to call on a strike. So for me to call off a strike, I must also call my neck, inform them that we have agreed. There's this offer on the table. If there is any offer that the government is willing to offer, there's an offer on the table. Do we accept or do we don't accept? If the next says accept and move on, we accept and tell our members to go back to work.
The last 3 strikes maybe you've had, have you made any progress? Because you see now also once government or even the public know you'll go on strike, and then it's called off, and then now we hear on the radio again talking about the new strike. But have you made any progress?
From the next
actually, this is a Kenyan strike. I dare say this is a Wanjiku strike. And I want to ask all the Kenyans to support all the healthcare workers in this strike. Because when we're asking about drugs being in the hospitals, when you're asking about healthcare workers being employed, you know, we have so many Kenyans who die at the casualties. I don't know whether you are aware of that.
Yes.
Some of them are dying at the casualty areas. Not because of anything else, but our healthcare workers are overwhelmed. No wachache. There are not enough healthcare workforce in this country. Yeah? So, we need to ensure that we either address, and you know the reason why there's this strike is because of the non-compliance with the stakeholders. The non-compliance with the Council of Governors, the non-compliance with the Minister of Health. If all of us agreed, for example, if we're talking about a CBA, we sit down, sign a CBA, and agree that this CBA is actually implemented the latter, then you never see another person going on strike. But the reason why there's, after 6 months, there's a strike, over 6 months, there's a strike, is because of the inability of the people who actually entered an agreement not to implement the agreement. So that's what we are saying. The health should actually go back to the national, because we feel at the national government, we feel a bit more safer.
Hot 96.